Mamai Flabo. Mamai Miku. Mamai Viefo. Very well. I am a product of Beaufort Company. All right? Just like Harrow, I am a proud product of Beaufort Company. Ladies and gentlemen, daughters, sons of St. Lucia. Dr. Anthony was my teacher at Beaufort Company. And Beaufort was bubbling. When we were growing up, Beaufort was bubbling. The market, the stores, at school, all over. Today, it is a ghost town. Jodi jou se boule tout côté, bow bow. All right? So Dr. Anthony has failed tremendously. Dr. Anthony has no plans for Beaufort or never had for St. Lucia. I left Beaufort Company. I went to the A-level college, went to university, and I came back to serve my country. I worked at St. Jude's. And let me tell you, before working at St. Jude's, I worked at Victoria Hospital in the accident and emergency department of the Victoria Hospital. No one can tell you about the effects of crime like a doctor and a nurse of the emergency room. When we get home, our coat is in blood. Our shoes in blood. We are traumatized after the shift because of the bodies that we see. And that has gone on for too long. It has gone on for too long. I remembered when I came back from university in 1990, we used to have like one bullet victim per year. Everybody used to come and help. Nurses from the maternity, to help us in the emergency room. Today, every weekend, and believe you, that the cases that we see and we hear on the news, that's the tip of the iceberg. Some of the victims or some of the people are not being reported. If you want to know the real cases of violence, you go to the emergency room of OKU and St. Jude's Hospital to know what crime is in St. Lucia. The impact on our emergency room is tremendous. Not only, I can tell you, because I can tell you from the days of the inner city in Castries and the days of Gabu and all of these things, we used to have, or the police used to have, what we call the Rapid Response Unit. And the Rapid Response Unit had to be stationed in the hospital because our staff were under fire too. I remembered very clearly one gang member was severely dropped in the emergency room, and the rest of the gang came back to finish him off. Everybody had to flee. Everybody had to flee the emergency room of Victoria Hospital so that the gangs can do whatever they had to do. All right? Luckily, one of the nurses hid the victim and he survived. Hid him from the rest. So that is what our emergency room has been impacted on from years. And we had a prime minister, okay? We had a prime minister, a minister of finance who is from Vieux-Fort and has not done anything for the young people of Vieux-Fort. And they continue to be in gangs, guns, and drugs. Is that the vision for our country? And our Prime Minister, Spider, said that he's a mumu, but all he says is, I don't know, I don't know, I don't know, I don't know. All right? How can you not know if you are the Prime Minister of this country? I want to dwell a little on St. Jude's. After leaving Victoria Hospital emergency room, I worked in the districts, Vieux-Fort Health Center, Saltibus, Grace, all over. The only place I didn't work was Soufrière. And I ended up at the emergency room of St. Jude's Hospital. Getting to St. Jude's Hospital and understanding the state of St. Jude's Hospital was an accident ready to happen. And that fire at St. Jude's was not by accident, because the area, the building was so deteriorated, was so much in a state that fire would have occurred anytime. Anytime. When that day or that night I left, when I got home, somebody called me from cantonment and said, Doc, what are you doing at home and your hospital is burning? I said, what kind of joke is that? They said, yes, the hospital is burning. So I think I drove down. I can't even remember what vehicles I passed. And we got there. I got there. And let me tell you, we worked throughout the night. Throughout the night to transport patients from St. Jude's to the school. And whilst we are transporting and doing that, we have to do our medical duties. And in the middle of that, we had to deliver a patient, a baby. So the pressure on the staff, the pressure on the nurses. And now we are seeing at OKU mass resignations. Mass resignations. I want to ask the Prime Minister and the Cabinet of Ministers, why are the doctors resigning? Why? Madam, why? Why? Why are they resigning? The conditions, no resources. The hospital in debt. No medication. Poor salaries. Safety. Okay, and they are not listening. They are not listening to the people. And people are getting better jobs outside of St. Lucia and going. Do you think our nurses want to leave? No. They've got children, parents, neighbors, grandparents, colleagues, grandmothers that they want to take care of. But if you cannot get a salary, and if you are subjected to conditions like that at work, you have no other choice but to leave. All right? So when you have head of surgery leaving, head of kidney dialysis leaving, of maternity, one nurse in maternity told me, Doc, thank you for talking out for us, because we are understaffed. Where are our midwives? Okay? Where are our midwives? We do not have midwives. Okay, we have student midwives in the maternity department. So, ladies and gentlemen, the Prime Minister if you're Mumu, you better figure out what to do. All right? Because you have a country to run and you have to do something. All right? Because young people are dying, and we, young people, are dying. Not only young people, but people within the hospital. One patient told me, Doc, okay, you is okay, kill you, enter at your own risk. I said, listen, please don't say that. I said, listen, Doc, I am telling you that's what it is. Because the place is being run like a fish market. Nobody. Now, I also want to make one pronouncement on the emergency room of the OKEU hospital. I don't know what kind of vision, but when you close Castries Health Center, Marshall Health Center has been closed a long time. You close Victoria Hospital, and you said you are doing what we call is an urban polyclinic. Where do you expect people to go to? They have to go to the emergency room of the OKEU hospital. And that is why it is crowded, loaded, frustrating, and everything. So the plans, you have to think of your people in the Castries Basin. They should be taken care of in the Castries Health Center. Even at Victoria Hospital, you would have taken off the load of the OKEU. I want to thank Alan Chasney for the COVID management and the vision that he had for the COVID. Also, Dominic Fede. We were one of the first countries to be on a lockdown. As a result, we were able to save many people. Secondly, Alan Chasney did a smooth and efficient transfer to the OKEU hospital. Thirdly, we had Victoria Hospital upgraded to take care of the COVID cases. Alan Chasney invested in Victoria Hospital during the COVID. He also invested in the quarantine centers. He invested in the COVID police. All right? Even if St. Lucians were being delinquent, but it saved their lives. Now, our Prime Minister continues to say, protect the victory, but we need to protect the lives of St. Lucia. Protect the lives of St. Lucia. All right? And we need St. Jude's Hospital. Kenny Anthony needs to say something about St. Jude's Hospital. He needs to have St. Jude's Hospital operational, modern, and to take care of the lives of not only of the people who vote for him, but for the rest of St. Lucia. We also need financing. Okay? Alan Chasney spoke about financing the healthcare system. Right now they have all kinds of different versions, but we need to finance our healthcare system. All right? And every St. Lucian is impacted by the healthcare system in this country. And I think I am tired. Many years I have tried. and I am tired, and I need to join a team that will do the best for St. Lucia. And this is why I stand here and I speak against this, what is happening, and I want something better for my country. I thank you.